Hello guys, in this video I'll be talking about how Sure Success Magic helped in the recent INICET November 2024 exam. I have put up screenshots from the book of the questions which were asked. There are about 100 screenshots here for 100 questions, and maybe another 20-30 will be there which are indirect, but I have put only the direct ones over here. As to what is the purpose of this video, I'll be telling you now. So what is the purpose of this video? See, my aim is to reduce FOMO and to reinforce the faith that you have placed in this book. What I mean by this? See, hundreds and thousands of you are using the book, and I've been telling you that this is a good enough resource to be used for a good number of subjects. I've made separate videos on that also. You would have seen that, or you can go through. But then you will find that some new resource came out with some new platform. Someone came out with a boot camp. Someone came out with a crash course. There's always going to be this fear that is this enough? So by making this video, I'm helping you to mark up your book. Whatever has come in the exam, you mark up that. So I've given you 100 questions over here. So what about the other 100? I will make another video where it is like an annotate with me kind of video where you can annotate the extra points. There are not only 100. For example, I can recall another 20 which are indirectly over there. For example, there is a question about the PARP inhibitor. What was this? Rucaparib. I have mentioned about olaparib somewhere else. So, but then that is not a direct one. Then what is the investigation first for pheochromocytoma? I have mentioned urinary metanephrine, but I have not mentioned the word first investigation. So I have not put those screenshots over here. So I'll be telling you in that video, in the subsequent video, to add that so that that makes your book more stronger. Believe me, I have gone through many previous papers of NEET, PG, INICET and FMGA and annotated the book already to a good extent. But if I find something extra, I'll always make an annotate with me video, and then you can see that and annotate your books. Of course, I'll be putting up PDFs of this video and also subsequent videos in the Telegram channel. So you don't have to pause each time and try to annotate. You can just see the text over there and annotate. So the purpose is not to claim any kind of strike rate or anything whatsoever, but basically it is to help you in the right direction. So let's start with the question, guys. So this figure from page 2 is quite self-explanatory, showing the parts of the sperm, and it also shows that the sheath of the middle piece is found by the mitochondria. So this is a question where they had asked that when you lift one leg, the tendency of that side to fall down is stabilized by which muscle? It is the gluteus medius of the supported side, which I have mentioned here under Trendelenburg sign. So in this topic of posterior interosseous nerve injury, I have clearly mentioned that it leads to finger drop and thumb drop. Wrist extension is possible, but not the finger and thumb extension. This is the flowchart of the oogenesis on page number 2, and you'll find that inside the flowchart I have mentioned that the primary oocyte is arrested in prophase 1, specifically the diplotin stage. The derivatives of germ layers is a very important table which I have given on page number 4, and this is a part of the table over here showing the neural crest derivatives. As we see here, the melanocytes, the ciliary muscles and other eye structures, and the ganglions. Ciliary ganglion is also derived from the neural crest. This was the question of the elderly man with dysphagia and bad breath. Answer was Zenker diverticulum, and this I have mentioned along with the figure on page 770. I will just draw your attention to bullet number 2 over here and read it out. Buccinator pulls cheek inwards towards teeth, preventing food accumulation in that area. And that was the answer to this question. A question on which is the first germ layer to be formed, which I mentioned in the table over here. Endoderm is the first layer, then ectoderm, and finally mesoderm. So which of the following does not require ATP, or in other words, which requires ATP? So here we see that active transport, primary and secondary active transport energy or ATP is required, and I also mentioned that the ion pumps, sodium potassium ATPase is one of the options over here which also requires ATP. I know that they had given you an electron microscopy image of the sarcomere and asked for labeling. This is a diagrammatic representation which I have given in the book, and it is very quite self-explanatory. Just go through bullet number 2 over here. The mnemonics also will help you answer any such question. Static touch or static 2-point discrimination and braille also is by the Merkel cells and mentioned in the table of receptors over here. This was a question about physiological dead space. I have given you two-page references over here. It is 120 and 122. Both of them are from respiratory physiology, and the screenshots over here. So what I'm trying to tell you is that it all depends on the flow and the correlation. You cannot expect questions in the exam from only one line or from only one box. But if you have read through that, you should be able to answer this. Again, two-page references I have given over here. The second one especially to say that when blood is stored, there is a depletion of 2,3-DPG, and whenever there is low 2,3-DPG, there is a left shift of the curve. This was an image-based question. So next to 2,3-DPG, just write in the brackets over here, stored blood. This was the match the following about amino acids and their derivatives. This can be found in the image over here under the topic amino acid derivatives. Just go through this very carefully. Anything can come as a question in the subsequent exams. Components of the electron transport chain and their inhibitors in the table over here. I have blown up the table over here to show which are all the inhibitors of cytochrome C oxidase. Again, micronutrient copper table over here. I have blown up the table to show about Menkes disease, X-linked recessive lysyl oxidase leads to kinky hair. This is from the topic sickle cell disease over here. Note that there is a point mutation which was asked as an MCQ earlier, and also that glutamic acid is replaced by valine, but I think in the exam they had given the option as ulta, probably a typo error. High anion gap and normal anion gap metabolic acidosis is a very important topic which is given in the table over here, and I've blown it up over here to show that diarrhea is a cause of normal anion gap metabolic acidosis. This is a comprehensive table from page 374 where I have mentioned autosomal dominant and X-linked disorders, and this is table wherein the mitochondrial inheritance is mentioned. So you have to remember the mitochondrial inheritance diseases. As for autosomal dominant, most structural diseases are autosomal dominant and errors of metabolism are usually autosomal recessive. Just trying to mug up the table is not very effective. Try to use some mnemonics, and rather when you read about the disorder, remember it also. Tumor marker tables over here will give you the answer for all of this match the following. So this is table which I have given on page 379 about the types of vacutainers and what they contain and what it is used for. For HbA1c, the lavender or EDTA tube is used. This was a little controversial question. What is not found in TTP? We know that this is the triad of thrombocytopenia, which are the three other options over here. Yes, thrombosis does occur, but it is more of a microplatelet thrombi formation within the vessel. So that is the odd one out over here. Hereditary causes of thrombocytopenia are given here in the right side column, whereas we know paroxysmal nocturnal hemoglobinuria is an acquired cause. Another match the following question. In this table, you will find answer for two of the options, whereas SMAD1 and tuberous sclerosis, I have mentioned it under the respective topics. During our annotation video, I will tell you to add this here also. Components of Me and 2B can be remembered with the mnemonic which are given in the book. It is called Feel Me Big Man. PHE here is for pheochromocytoma. Me is for medullary thyroid carcinoma. Big Man means Marfan's people are usually tall and big. So Big Man is for Marfan syndrome. Again, BB over here is for big bowels or megacolon. And in man, MN is for mucosal neuromas. Easy to remember everything that way. Question on glomerular hematuria, which probably is referring to the glomerulonephritis over here. So we know that edema is not so common in this as in nephrotic syndrome, and we know that the urine is usually cola colored or brown colored urine. Casts rather than crystals are seen. Granulosa cell tumor we know is a sex cord stromal tumor. So this I mentioned under the classification. Fibroma, granulosa cell tumor are sex cord stromal tumors. Match the following question asking for the bodies. Earlier I had a table in earlier editions with all these bodies in one table. Now I have mentioned it under the respective topics and various pages. So just it is given, everything is there in the book, but I will tell you to put it in one place along with the other bodies on page 337, I think. Carney complex or name syndrome, which was asked over here, it is given under the cardiac tumors on page 690. So again another question from the vacutainers. So this table is purely theoretical, which I've taken from the pathology books, and some of the faculty have agreed that if it is as per the books, then green is the answer over here for electrolyte estimation. But then most people have said practically it is red or yellow. So I don't know what the examiners are asking for, but as per the books, this table is right. When it comes to celiac disease, we know that it is associated with HLA-DQ2, so this option is wrong. As for transglutaminase and anti-endomysial and anti-gliadin antibodies, these two options are taken care of. March criteria, which is something which you'll have to annotate over here. So disease is preventable by vaccination. We know CA cervix with HPV vaccine, which I mentioned on page 916, and on page 227 I mentioned about hepatitis B vaccine. In the other two options, we know there are no vaccines available. The schwannoma image I have mentioned, or rather I have given it on page 1066, just go through that. Whereas the other options about schwannoma are covered under page 566 under the topic of acoustic neuroma slash vestibular schwannoma. Very simple question over here. Which virus spreads through water among all the hepatitis? So I mentioned it in the mnemonic also over here, saying A and D are fecal-oral. That is the vowels A and D hit your bowels. About the roundworm or Ascaris lumbricoides, you have to rule out which is the wrong option over here. We know that Trichuris trichura causes rectal prolapse, which I am pointing to over here, and that is mentioned on page 242, whereas the other options I have mentioned on page 241. So all of us have been through the pandemic. We know we wore a mask, we followed cough etiquette, we got vaccinated. Ivermectin, maybe few people took, the majority did not take. And here I mentioned in the book also the drugs which were proposed but not actively used are hydroxychloroquine and ivermectin. So in this comprehensive table in microbiology on page 226, I have mentioned about the epsilometer test or E-test, which is one of the tests for antibiotic sensitivity testing. This is a summary table of the different types of sterilization method. I have blown it up over here for the question which was asked about the metallic inoculation wire which we use, and you have to heat it for until it becomes red hot under the flame of the Bunsen burner. Gardner with lymphogranulomatous lesions along the arm. We know about Rose Gardner's disease, which is mentioned over here. So the answer is porotrichosis. Patient walking barefoot, which of the following infections is most likely? So commonly affecting the foot more than the hands, which is the one, Mozzarella mycetoma. A very simple question, makes you wonder why did they ask this, but anyway, under the Mycobacterium tuberculosis, I mentioned about Lowenstein-Jensen or LJ medium over here. Streptococcus pyogenes causing necrotizing fasciitis, mentioned over here on page 196. Gram-positive cocci in chains is Streptococcus. A child with diarrhea, with fever, thrombocytopenia, and hematuria, which most likely points to hemolytic uremic syndrome. I mentioned over here, EHEC causes hemolytic uremic syndrome. So, weakly gram-positive filamentous bacteria causing infection, that was one of the questions, and pointing to nocardia, which I mentioned on page 215. So as we know, autoclaving is not a cold sterilization, rather it is one of the most commonly used sterilization methods in the operation theatre, where temperature rises to 121 degrees centigrade for 15 minutes. So under the topic of urethritis in men, I have mentioned that chlamydia trachomatis can cause it, gonococcus can cause it, trichomonas vaginalis can cause it, and mycoplasma genitalium can cause it. You will find that I have mentioned about all these three options over here in this paragraph of Cryptococcus in the microbiology chapter. Also in the 8th chapter, I have mentioned about the criteria for the CD4 count of Cryptococcus. So if you correlate these two, you will get your answer. Which vaccine is not indicated above 65 years? We know HPV vaccine and the age groups over here are given. The other three are very well given for elderly patients. So under PSM chapter, under vaccines, I have mentioned about the live vaccines and given the mnemonic over there. I want you to add rotavirus also over there. But HPV we know is a recombinant vaccine and that is the answer over here. So where does the first stain swab go? It goes into the yellow bag over here where I have mentioned it here. Yeah, microbiological waste and then yeah, solid waste, cotton swabs, dressings, I mentioned it. Rotavirus is the most common cause of diarrhea in infants and children and that is the answer over here. So this is a table from page 239 where I have talked about the liver flukes. I have enlarged the table over here to show that for fasciola hepatica, triclopentazole is the drug of choice. Page number 992 is a very important page in psychiatry chapter. Read the entire page. You will find the answers for all of these questions over here. I am sure that this is commonly asked topic every year. Drugs and their antidotes. Just go through the table over here. One question in the exam is usually guaranteed from this. I have mentioned the options here. The immunosuppressants or disease modifying drugs are commonly used in rheumatoid arthritis. Question was about ulcerative colitis and they had asked which is the JAK inhibitor to be used, and I mentioned it over here that rofacitinib is the JAK inhibitor which is to be used. So I mentioned over here under etomidate all the effects and it also suppresses adrenocortical function, which was the answer over here. So this is the comprehensive table about anti-HIV drugs which I mentioned on page 255, and I have enlarged it over here to show that ibalizumab attaches to or rather blocks the CD4 receptors, which is false regarding thiopentone sodium. I mentioned consciousness usually returns after 4 to 10 minutes as a result of redistribution and not renal excretion as we know. So the classical Marshall's triad is seen in secondary blast injury along with the mnemonic. I mentioned it on page 454. So on page 471 over here, you have the topics of both copper and phosphorus. So that is why I have given the copper sulfate figure over here. And on the right side under phosphorus poisoning, I mentioned that copper sulfate is used to precipitate phosphorus. So under the table of grades of evidence in clinical research, I have clearly mentioned that the highest level of evidence is systemic review or meta-analysis, which is the most reliable. So how did this question come over here? Okay, the Chevalier fracture. I mentioned over here that it is a vertical fracture of the septum. I admit that the image I have not given over here, but remember this for future. This is one of the rare non-direct question which I have mentioned in this 100 questions compilation. So the uses of autoacoustic emissions are it is used as a screening test of hearing in neonates and mentally challenged patients. So that is the answer over here. So bilateral recurrent laryngeal nerve palsy causes the cords to lie closely opposed and results in dyspnea and stridor, which is basically a life-threatening condition. Regarding the causes of croup, we know that the most common is parainfluenza virus, but I have also mentioned the other causes over here, including influenza virus, which is the answer over here, whereas acute epiglottitis is caused by streptococci. So regarding NADA's criteria, I mentioned it in this paragraph over here, clearly major and minor criteria, and we see that elevated troponin is not a component of this criteria. So regarding severe acute malnutrition, which is not included in the diagnostic criteria, we know height for age is not included. I know there was another question about severe acute malnutrition, and that I will include it in the annotation video. So a very important table of developmental milestones from page 587. Just go through that. Lot of mnemonics within the table itself. You know, a child can copy across. Yes, given over here. Tells a story. Yes, given over here. Go to toilet. You will have to add over here. So the various features of cystic fibrosis I mentioned elaborately over here, and we know that biliary atresia is not a component, whereas the other three can occur. So another important topic from page 739, there were two questions from this topic. The HLA-B27 mentioned over here, ankylosing spondylitis mentioned, anteriovitis and sacroiliitis, that is the answer. We know that in psoriatic arthritis, dactylitis or sausage digits is present. Nail pitting occurs in almost 90%, I mentioned over here. Enthesitis, yes, all HLA-B27 arthritis will have inflammation at the site of insertion of tendons. Diarrhea is not in favor of this here. The fact that diabetes or proliferative diabetic retinopathy can cause tractional retinal detachment I have clearly mentioned in the retinal detachment table over here. Also under diabetic retinopathy I have mentioned it on page 520. A very commonly asked question, pterygium and astigmatism. Just go through this pterygium paragraph over here. You will find everything about it. So in fundus fluorescein angiography, how do microaneurysms appear? So if you see in this figure, I mentioned the bright spots indicate leakage from microaneurysms. The darker areas are the avascular area. So that is your answer there, hyperfluorescent dots. Sequential arrangement of the layers of the retina clearly mentioned in this table over here, and the caption below it gives which are the layers from outside, that is from the choroid side to the innermost side. The choroid side will have the retinal pigment epithelium and the innermost side will have your nerve fiber layer. No doubt, no controversy over here. Whenever any patient comes in with a chemical injury, immediately make him lie down and start irrigating copiously with normal saline or linger lactate, whatever you find. Copious is the word which was used, I have mentioned over here. So this is a table showing you both electroretinogram and electrooculogram, and under EOG clearly I have mentioned that subnormal EOG is confirmatory in West disease. ERG is normal. Regarding a premature child who came with leukochoria and intraocular calcification, the pathognomonic sign, so go ahead and mark retinoblastoma, no confusions over here. Just see the figure of retinoblastoma also, I'll include it later. That can come as a question in the future. So in this blue color box on page 1014 in anesthesia, you will find that I have given a lot of mnemonics, and I also mentioned that Jackson-Rees modification of Mapleson E is the circuit of choice for children. So under ureteric colic, I think that was the question, right, about ureteric stones. Gold standard test is helical or spiral CT without contrast, or NCCT, which is given in the option over here. So imperforate hymen with a bulging perineal mass or vaginal bulge, then what? History of primary amenorrhea. That is the answer over here. So in this table of the diameters of the pelvic inlet, true conjugate, obstetric conjugate, diagonal conjugate, I have enlarged it over here where I mentioned that obstetric conjugate 10 centimeter is the shortest AP diameter. So instrumental delivery is not done in which of the following conditions. So in this page 885, I have given the indications for instrumental delivery, and under contraindications, absolute contraindication, we will find that cephalopelvic disproportion or CPD is an absolute contraindication. Very commonly asked topic, bacterial vaginosis caused by Gardnerella vaginalis, that is the answer over here, fishy odor with whiff test positive. I know the question was about secondary amenorrhea, but here I have mentioned what are the causes of high FSH and high LH, what are the possible causes, and low FSH and low LH, what are the possible causes. This is a typo error over here, just make this FSH, okay. So the triple test and quadruple test compared in the table over here, you will find your answer over here that it is inhibin A and not inhibin B as mentioned in the question. Which is not a physiologic change in pregnancy. It is difficult for me to put screenshots of each and every bullet which I have given over there. Just go through that one page topic, you will find the answers. All these I have mentioned over here. So I have just mentioned the heading over here. Active management of third stage of labor, a short topic which contains all of your options over here, and the answer you will find over here. Bimanual compression is done during the treatment of postpartum hemorrhage. I have given that also in the next topic. So incorrect statement about ectopic pregnancy, all the correct statements I have mentioned it already in the topic. We know that methotrexate is given intramuscularly in these cases and not orally. Previously I had given only the grading of bed source over here, but since images were asked, I have given the image also, so that way it becomes quite complete for you. Go through this, you will find the answer. So in the book I have mentioned a few of the stagings which are very important, and one such is the breast cancer staging. The TNM staging is mentioned, and for the given question the answer was option B, T3N2 M0 in this particular question. So a post-gastrectomy patient with imbalance, Romberg sign positive and lower limb weakness, neurological signs, you will suspect vitamin B12 deficiency. So under the topic of vitamin B12, I have clearly mentioned over here as gastrectomy, the particular word itself is mentioned. So on page 693, you have this very comprehensive table of inflammatory bowel disease comparing ulcerative colitis and Crohn's disease. And I have enlarged the one box over here showing that true love Witt's criteria is used to assess severity. This is under ulcerative colitis. When it comes to Zollinger-Ellison syndrome or recurrent peptic ulceration, gastrinoma, I mentioned the boundaries of the gastrinoma triangle along with the figure over here. I think this is a slightly controversial question with various faculty differing among the two options which were given. So we'll have to see what the examiner decides for this. So a patient with a history of CA esophagus, so I have given the symptoms over here, presents with dysphagia for solid foods first, then for liquids. That is what was asked in the exam. So this is a question about, I don't know whether the wording is exactly the same, I got various versions over here, but basically saying that the skin was closed 5 days after surgery. So what is this type of healing? This is what we call as a delayed primary or tertiary intention healing. So this, I have enlarged this box over here and mentioned it here. Clearly you can see the answer over here. This is a question on arterial disorder, a smoker who presented with pain, etc. So I assume the definition of intermittent claudication was asked and the various options were given. You can find the answer over here. This is a table from physiology chapter page 137 wherein LMN lesion versus UMN lesion. I have clearly described over this here, and here you will see that hypotonia and fasciculation or fibrillations are found in lower motor neuron lesion, and given the relevant mnemonic also over here. So of all the screenshots which I have shown over here, probably this is the one thing which is missing one option, that is intestinal like Crohn's disease under Besset's topic. But clearly I have mentioned that the genital ulcers do not affect the glans penis or urethra but produce scrotal scars. This is actually a question from a direct pick from the Harrison's topic. And when it comes to delayed cord clamping in the neonatal resuscitation, clearly I mentioned that delayed cord clamping for more than 30 seconds is reasonable for both term and preterm infants who do not require resuscitation. Just add the word vigorous over here and you have your answer.